So let's learn about CBD oil and the CBD receptors. What we're going to talk about is the what and the why, or the basics of cannabinoids, and the CBD oil. So CBD oil refers to compounds. Basically, it contains compounds called cannabinoids. These cannabinoids refer to structures that are very similar to structures that are normally very natural in a person's body. These structures were combined and bind with the cannabinoid receptors within your body, and this stimulates a reaction. The stimulation of these receptors stimulates a reaction that gives you a lot of benefits. It's like we're putting these pieces of the puzzle together within your body to try to make it better for you, make you have a better health and maybe less degenerative problems. So there's three types of cannabinoid compounds. There's endogenous, that's the natural, innate cannabinoid system. It's called an endocannabinoid system. And these are compounds that are innate in all of our bodies. There's a type from the cannabis plant, or what they call phytocannabinoids, and then there's other food sources of cannabinoids. So the endocannabinoid system is really a system that's all over your body. We have receptors all over our bodies. These receptors are in most all organs of the body. They're in the brain, they're in the heart, the GI tract, they're all over the place. So why did we not learn about these a long time ago? Why do we not know that there was an endocannabinoid system present? Well, the fact of the matter is, it really wasn't even found that we had an endocannabinoid system until maybe around the 1990s, where some researchers did some studies. They found out, wow, we have this little modulation and regulation of our nerves through this endocannabinoid system, and it's a natural system. It occurs in everybody. We just never knew about it. We didn't know the existence of it, but the fact that we do have this phytocannabinoid enabled us to kind of do some experiments and evaluation on this to find out that, wow, we have this great system and it does some good things to your body, which we're going to talk about. Now, these receptors are activated naturally. They occur in your body. In your body, the natural products are called endocannabinoids. And there's a bunch of them. Together, these receptors and the compounds act as a signaling system. And there's a bunch of them in your body here, and this is just a little schematic representation of these. So the endocannabinoid system plays a role in multiple functions. But the CBD, the cannabidiol, primarily plays a role in boosting your immune system. That is a system that is essential to protect yourself from a lot of different things that come at your body and can harm you. We'll talk more about this. But for homeostasis, we want your body to be function in the most healthiest fashion. And cannabidiol, the endocannabinol system, helps create that homeostasis, so you do have better function in your body and you have a healthier body. So you're putting the pieces of the puzzle together to try to create your hemostasis or a healthier body. The endocannabinol system affects a lot of different organs, but the main action is to do immunomodulation. In other words, it's helping your immune system to work in a more efficient fashion. This more efficient fashion affects the GI tract, your heart, your skin, lungs, etc., the bones. It affects almost every part of your body. The endocannabinol system is a pretty amazing system. It's basically split between two different types of receptors. You have the CB1 receptors, which primarily affect the brain, and the CB2 receptors, which primarily affect the immune system. The immune system to help your body become healthier. And stimulation of these activates these receptors to do a function. And the function, at least in the immune system, is to modulate your immune system so it's better, more efficient. Once again, CB1 and CB2, they both affect all the organs, but CB1 primarily is in the brain, CB2, it's in the brain, but mostly it modulates the immune system through all of these organs. There are some other endogenous ones. In other ones, these are the endocannabinoids that are normal for your body. They're natural. Things like anandamide and 2-arachidonyl glycerol. There's a bunch of them. These are normal, just natural endocannabinoid compounds that do the same type of thing. This is what happens naturally. This is in our body. It's innate. It just so happens that the CB2 or the CB2 receptors that will affect the immune system are stimulated by CBD oil or cannabidiol oil. And that's what we all want to learn about. The cannabidiol, CBD, cannabidiol. It's quite different from tetrahydrocannabinol. Tetrahydrocannabinol is the active ingredient in marijuana. Well, we're not talking about that. This is not the ingredient in the CBD oil. Tetrahydrocannabinol, it is a psychoactive drug. It causes the euphoria, and it is the phytochemical in marijuana. It is a scheduled drug. We're not talking about, there's none of this in cannabidiol oil. The cannabidiol oil affects mostly the CB2 receptors, like I said, primarily affecting the immune system. And it is not psychoactive. It has medicinal value, and it's the most dominant phytocannabinoid in industrial hemp. So as I said, there are three areas where the cannabinoids are. One within the body in the endocannabinoid system, and the second one is in the cannabis or hemp. Now the hemp, the plant containing the most abundant cannabidiol is hemp, and hemp is produced from the stalks of the cannabis plant, which is quite different than the leaves. Now, the leaves usually contain the tetrahydrocannabinol, and we don't use those to produce the cannabidiol. This is the marijuana part of the plant where you get the THC. There's no THC in CBD oil. Let me emphasize that. There is no tetrahydrocannabinol in CBD oil. It is strictly the other part, the stalks. It's quite different. The stalks from the hemp plant produce the cannabidiol, while the leaves produce more the euphoric type of drug, the marijuana. It's very different, and the emphasis is that CBD oil does not have this. As a matter of fact, it's illegal to have any CBD that has more than 0.3 amount of THC, which is very, very small, 0.03. There are some other foods that do contain cannabinoid compounds too. They're lesser in amounts in these foods, and they don't really produce a major problem. So we eat all these, and these are very safe. They're things like oregano, hops. We eat chocolate, carrots. They have cannabinoids in them, but they're fine to do because they're not addicting. They don't have any tetrahydrocannabinol. So let's talk a little bit about the signaling system, because I think this is very important for us to understand how this works. Well, you have normal nerves coming to a synapse. And this is the ends of the nerves right here. And in the synapse, you have a presynaptic cleft. And you have, as the nerve pulse comes down, it releases neurotransmitters to go across the membrane, across this space here. When it goes across the space, it stimulates the postsynaptic area to continue the nerve transmission on. Well, the cannabinoids affect the postsynaptic area. And when it does that, it creates a feedback to the presynaptic area and modulates the release of these for your benefit. It's sort of like having a traffic cop to control the function within your nervous system. We'll call it the hidden nervous system, because we really didn't know about this until maybe 10, 20 years ago. It's pretty amazing stuff. And it regulates the flow of the neurotransmitters coming out of the presynaptic ends of the nerves, which then affects the postsynaptic nerve reception of these signals. to then carry it, but it's modified by the endocannabinoid system. So the CB2 receptors use this same system as the CB1 receptors do, but the CB2 receptors do this for immunomodulation, to modulate your immune system. And they do so on demand. So when you modulate your immune system, it's like you're kind of signaling the system to modulate your cells to seek and destroy abnormal cells, your bacteria, viruses, maybe even cancer cells that might even form. And they try to repair your body. So you got your little soldiers, you're recruiting them to come out there, seek and destroy the bad guys and destroy them, destroy damaged cells, and to help your immune system to be more efficient at doing this. The unfortunate thing is sometimes when you get too much of this, it can cause collateral damage, and that's where the inflammation, where you get too much immune function, that's inflammation. We'll talk some more about that. But you can see if you get too much, shoot them up, too much damage, then you're going to get damage to your tissue. So we want to avoid that with this immunomodulation of the endocannabinoids. So it affects lots of different areas. As I mentioned, the immune function, decrease in inflammation, but it also affects a lot of different things like your stress response, the ability for you to sleep. It does have a factor on pain sensation, so it can decrease pains and arthritic pains and whatnot. Helps that on memory, fertility, calorie metabolism, and appetite. It does have functions on that. And some of your organ functions like your cardiovascular, your bones, joints, heart, your brain, your GI tract, your liver, and your skin. All these are organs that have these immunomodulators in there, these natural endocannabinoids to help them to be better as far as their immune system. These effects on the body include anti-inflammatory effects, antioxidant effects. We've heard of oxidation when we get older. Ideas that we have too much oxidation, and so you want to have an antioxidant to decrease that aging degenerative process. It is an anxiolytic, pain reliever, analgesic, and it actually, CBD has a very good effect to decrease seizures. So it is very good as an anti-epileptic in a certain dose. One of the things that I think is really neat and pretty good for everybody is its ability to be an anti-cancer type agent, anti-tumoral, to kind of decrease the risk of you developing cancers. It is neuroprotective, it protects the brain and the nerves, and it also dilates the vessels. So it hits a lot of different organs, But let's talk a little bit about the immune response, because we're talking about immunity here. And so if we're going to decrease or control in the immune system, let's talk about how that can affect you. Well, we got a little foreign antigen here. It's going to be identified by our immune system, like the T cells, and it forms a complex. Well, once the T cells identify this, then the T cells respond by producing the compounds, many compounds. Some of them are called cytokines, and the cytokines go to the cytokines kind of broadcast that, hey, we got a foreign invader in here, we need to get rid of him. So cytokines are going to broadcast this out. So he's going to call in some recruits. And here's all the recruits here. Think of them as your little soldiers. They're going out to seek and destroy and kill those bad things, those bad antigens that can hurt you and harm you. We're talking about things like bacteria, viruses, pollutions, byproducts of metabolism, even mutagenic cells that are mutated and therefore can become cancer cells. All those things are foreign to the body. So the immune system needs to clean up all those things. And when it cleans it up, it destroys them with your little army. So all these different things, the phagocytes essentially chew them up just like a little Pac-Man can do it. Natural killer cells, well, sounds like we know what those things do. And you kill, and then the T cells receive the message. They also eliminate the enemy by point and shooting type thing. And then we got the antibodies. The antibodies are produced by the B cells, and these antibodies literally go and kill the offending agents. All these add up to your immune response. We want a good immune response, but we don't want to have excessive immune response, because when we get an excess amount of immune, we got to use bigger guns. And when you use bigger guns, well, you get more collateral damage. More collateral damage, you get things like inflammation. And that inflammation is not good to our body. That's the thing that hurts us. Well, CBD oil has been shown to help and or prevent or treat inflammation in your body, and the inflammation is the bad stuff. Well, we all kind of know a little bit about inflammation. We know that when we get hurt in our hand or any part of our body, certain things happen. Inflammation has many faces. As this cartoon depicts, you get heat in the area. You get some redness in the area. You get some swelling. You get some pain and loss of function of the area. These are all signs of inflammation that we're all familiar with. But in the microscopic level, it's a little bit different. You've got these little areas of inflammation. You got too much collateral damage, so basically just chewing up the tissues. But the endocannabinoids will try to decrease that through their immunomodulatory effects. And by decreasing the inflammation, they can decrease the swelling and all those signs that we just noted, but also the pain can get better too. So you want to have a decrease in the inflammation. Or, you can take medicines. There's a lot of existing pain medicines that you can take, but a lot of them have gastrointestinal problems. You can develop ulcers. Some of them kind of impair your ability to think very well, and some of them cause some dependence and tolerance. So we don't want to do that if we can avoid that. But CBD works on a very different type of a system, and it actually inhibits pain pathways and reduces the inflammatory signals. In other words, inflammation signals in these pathways, and so CBD can actually diminish that and inhibit that. And there have been many studies that have shown the effectiveness of CBD and CBD oil on arthritic painful conditions, such as this one animal model. This is an animal model, so it was a kind of a unique type of situation and could be very well controlled. So if you look at the joint of a normal animal, they have a synovial thickness that's very thin. There's not very many inflammatory cells. It looks nice and healthy. But when you have inflammation involved, these little areas of dark little spots, those are inflammatory cells. All those that little army of guys, all those T cells and the lymphocytes, white blood cells, all those still little inflammatory cells, they infiltrate into here because it's been damaged and they want to repair it. They want to fix it. They want to get rid of any kind of bad collateral stuff that might be going on, but they do cause quite a bit of collateral damage. So you get all this swelling there. Well, if you take CBD oil, this swelling goes down markedly, and that's depicted in these graphs here. And this one here, there's a placebo arm here where they just give them just water, basically, and they didn't do anything. But if you give them the CBD, there's a marked decrease in the pain sensation. So there's a lot of other studies that are similar to that, and there's studies on chronic pain where they give CBD to people with chronic pain. And once again, whether you add other things with it or just the CBD, you have a decrease in the pain, decrease in inflammation in the pain. So it's very helpful to help people to treat patients with chronic pain. This includes rheumatoid arthritis type of issues, osteoarthritis, all other types of arthritic kind of conditions that might result in chronic pain. And there are multiple studies and dozens of trials and studies on this that have shown the effectiveness of this. So it's good stuff. It gets good treatment for chronic pain. And I think it's one of the newer types of treatments that are pretty benign. And really, doesn't have a lot of the side effects of many of the other drugs. What about protection of your CNS, your brain, your nerves? Well, it just so happens that CBD, due to its immunomodulatory effect, can preserve your neural system. It helps prevent neurodegenerative systems such as Alzheimer's disease, Parkinson's disease, certain dementias. It helps prevent against stroke or trauma. And it is especially helpful on all these things, but it does so not only as a immunomodulator, but it is an antioxidant too. So it works in multiple ways. So nobody wants to have Alzheimer's. So if there's something you can do to decrease your risk, CBD oil is one of those things that you can do. It's very benign to decrease those risks. These types of inflammatory processes occur because of deposition of beta amyloid and inflammatory tangles. And this is a schematic representation of this in the brain. This deposition of these inflammatory tangles and the beta amyloid are what cause the problem, what causes the problem in Alzheimer's disease, where you get slow function of the brain cells and the neural cells. Well, because the CB2 receptors modulate this immune system and tend to make it better to repair these systems, you potentially have a really good treatment for protection against some of these neurodegenerative problems from happening. So this is a little schematic of this. You've got the nerve cell, you've got your CB2 agonists like CBD oil administered. And what it does, it affects a lot of these inflammatory processes on the inflammatory nerve, the inflammatory cells. These cells are the microglia cells and the astrocyte cells. And the result is you have less of this alpha-synuclein, or which we call the part of the deposition of the inflammatory tangles, and also the beta amyloid. Less of this, so you've got protection against the degenerative problems. Similarly, you've got protection against traumatic brain injuries with CBD. The CBD has been shown to decrease brain edema, death of the cells, and improve the functional outcomes over the long time. It helps regulate the transmission and regulation of the pain perception, and because of its immunomodulatory effect, it decreases the inflammation in the brain that occurs with all brain trauma. And it also is an antioxidant, and it reduces oxidative stress, and that also helps out. So you've got pretty good protection. What about the heart? Well, it just so happens that CBD can reduce cardiovascular disease through multiple pathways, but the primary one is by vasodilation. So you have less of a chance of having a heart attack, dilates the vessels, so you get better blood supply. It also protects against high glucose lows, which can cause some damage, and also ischemic damage, the lack of the oxygen there. All these are protective effects. A lot of them have to do with the inflammatory reaction that occurs once you have a heart attack. What about in the bone? A lot of times we don't think about CBD affecting the bone, but it is a very good pump and builder of bone. You do have CB receptors or cannabinol receptors in the bones, and the stimulation of these receptors results in repair and building of the bone. So you have bone formation, and the result can be potentially a good treatment for osteoporosis or prevention of osteoporosis. And it works in this fashion. There are two processes that occur in the bones. There's a breakdown of bone that's done by these little guys called osteoclasts. And think of them like little Pac-Man. They break down the walls, they break down the structures of the bone, and they just chew them up like little Pac-Man. And that's the osteoclasts. Then you have the osteoblasts, which are another group of cells that lay down new bone. They lay it down, they form the new bone, and they build it up. So activation of the CB2 receptors, such as in CBD oil, can stimulate formation of bone, building of bone, but at the same time it suppresses bone breakdown and absorption, or osteoclastic activity. So it's a real good possible treatment, or at least preventive type treatment for osteoporosis development. Well, as we age, we do get exposed to a lot of different stresses. The way we eat, we have stresses in our in our life, that emotional stresses. We got pollution, those kind of stresses. This chronic stress can impair our immune system, and the result of stress can lead to certain kinds of cancers. And this has been proven through research. Yes, stress can lead to cancers, as noted in one recent Lancet article. In addition, eating too many carbs can be a problem. That can cause a stress in your life. And actually, eating too many carbs increases your risk of cancer. Cancer cells, who come to find out, don't survive very well in a non-glucose environment. They like glucose. They survive great when there's a lot of glucose. But if they can't mobilize it, mobilize the glucose well, and all you have are fats fueling your body, as in something like a ketogenic type diet, cancer cells don't work well. So CBD works to try to decrease the inflammation of all these stresses that occur in our body. And cancer is a big deal. We want to try to decrease the risk of cancer. So CBD oil has been shown and been proven to be effective in slowing and shrinking some forms of cancer. For instance, in this one study, it was found to shrink brain tumors, and there was a significant reduction. So here's placebo arm, and here's the CBD, same type of thing. The CBD shrinks the tumor, so the tumor size gets less with just CBD oil. And research has shown us that the CBD works in three different factions, three different ways to kill cancer cells, to decrease incidence of cancer and the growth of cancer. Number one is something we call apoptosis. Apoptosis is when the cells are convinced to kill themselves. Yes, the immune system is tweaked by the CBD, so you get immunomodulation to literally have the immune system go in and do some changes of the cell, which makes the cell rupture or self-suicide. It kills itself. And here's a microscopic type view of this happening, and it really happens in real life. So you're using your own system, your own immune system, to kill your cancer cells through this apoptosis technique. The second way CBD induces cancer cell death is to try to starve it. Basically, when you have a cancer, a tumor forming, you have to have vessels grow to the tumor to feed the tumor. So pretty soon you get a lot of vessels and more vessels. But if you take the CBD, you decrease the formation of this. This formation of these vessels is something we call angiogenesis. And you're essentially starving these cancer cells. And it occurs in a lot of different kinds of cancers, and it's very beneficial to decrease the cancers. Then the third method is to inhibit tumor cell proliferation. So we all know that if you let a cancer go too long, it metastasizes. In other words, it proliferates so much that pretty soon it goes out of the initial organ and metastasizes to other spots. Well, if you take CBD, it's less likely that you're going to have metastasis. CBD tends to inhibit this, and studies have shown that to be true. Now, what about the bowel? The bowel, there is definitely a brain-gut connection. We all know that when we get butterflies in the stomach, when we can get nauseated when we see something that we don't like too well, and there is a connection. We all see that connection between the brain and the stomach. These are neural connections. Once again, remember the CB receptors, the campanol receptors, are in the synapses of the nerves, and by stimulating those, at least in the CB2 receptors, you have immunomodulation, you decrease the inflammation in the gut, and you get better function of the gut. And less inflammation causes less problems with your GI tract. And there are a lot of chronic conditions that you get lots of inflammation, irritable bowel, inflammatory bowel diseases. These all potentially could be helped with the use of CBD oil simply because of the fact you're reducing the inflammation. And inflammation is a key to all these things that we've been talking about. Inflammation, it's the bad thing. It's the secret killer of all of us. It's the process that occurs as we get older that develops these that forces us to develop these degenerative problems. So we want to try to prevent those as much as possible. These chronic diseases can be things like rheumatoid arthritis, heart disease, Alzheimer's, metabolic syndrome, where you get elevated blood sugars, you've got elevated hemoglobin A1C, you've got obesity, and you've got elevated triglycerides and hypertension. So metabolic system can be decreased markedly if you just add on a little CBD. We talked about ischemia with the heart, it can be less, and many other conditions that are chronic conditions that we can occur. So what do you do? Well, we now know that we can put these pieces of the puzzle together and get a better homeostatic, a healthier body by adding CBD to this, to immunomodulate. This immunomodulation is key to reduction in inflammation in all the organs that cause these degenerative problems, heart disease, Alzheimer's, etc., and cancer. So CBD oil is one of the products available that can improve your health through activation of this endocannabinoid system. So I'd like to thank everybody for joining me today. And if there's any questions, I'd be happy to answer any questions I possibly could. Will CBD make you fail a drug test for marijuana or THC? There's essentially no THC in CBD oil. It will not cause a positive test for marijuana or THC. And it's a requirement by the government that you have a very, very small amount of THC, if anything, in CBD. And most good products of CBD have none. They don't have any tetrahydrocannabinol in them. So they're not going to affect your brain. They're not going to cause the euphoria. They're not that kind of a drug. They are being used for immunomodulation. So how is it taken? Well, there's a lot of different preparations. The best thing to do is get the whole oil, in other words, the pressed oil that comes directly from the plant, and that has all the cannabinol products in it. Cannabidiol is tested and it can be concentrated in this oil. So when you do the oil, probably one of the better ways to administer it is to use a spray and just spray it into your mouth. You can swallow it. Most preparations, they do like 5 sprays every day, and that gives you your daily dose of your cannabidiol, enough for the immunomodulation. Now, some people need it for other things, like if you're using it for like epilepsy and stuff like that, you need a higher dose. But most people can have a moderate dose of CBD and you don't need it. Anxiety can be used. It can be used for anxiety, and once again, you need a higher dose. So it really depends on what you're going to use it for as far as the concentration and the amount that you need. But it's easy. It's just a spray in your mouth. And where can you buy it? There's a lot of different places to buy cannabidiol. We carry it in our office. There's lots of CBD stores open all over the place. CBD is quite available now. It's the oil that is grown primarily in areas where growing marijuana is legal, such as Colorado or Oregon. They're extracted, and then we just use the CBD. That's from the hemp. That's from the hemp. There are the stalks of the cannabis plants. None of that is the THC.
Dr. Chu, we have a lot of questions.
Okay.
Okay. One you have is there a recommended daily dosage, which you just went over?
Yeah. So if you're just using it for like immunomodulation, just to decrease inflammation in your body, perhaps for analgesic effects to decrease pain, there are several different preparations. You can do something like a 500 in a bottle or a 750 in a bottle, but sometimes you need a higher dose. So there are different products. So like say for instance, I don't know if this shows up very well. Probably not. It's not showing up very well. But anyway, there are different products. There's a product by Blue Jay that's got like 500 or 750 per vial, per bottle, and 5 sprays of that into the mouth every day will help. And if you're a larger person, you need like the 750 bottle. Smaller person, maybe the 500 bottle. And then there's also a salve, a cream or an ointment that you can rub on that works very, very well. Blue Jay produces a salve, and there are a lot of other companies that do a similar type of thing. But Blue Jay has real good quality. They get their stuff from Colorado and Oregon, and we kind of like the Blue Jay products because they have good quality to them and good quality control. They make sure that there is absolutely no THC in their product. It is just cannabidiol.
Are there any negative effects is a question.
Oh, are there any negative effects to cannabidiol? Really, there's really none. The cannabidiol doesn't have any side effects really at all. Now, there is an occasional person that can respond kind of in a different fashion to cannabidiol. And so therefore I suggest that whenever you start using it, you do 1 or 2 sprays and see if you are reacting to it. Some people do react to it in an unusual fashion, but it's not anything that's harmful to them. It's just a little unusual. They feel a little funny. And once they get used to it, it's really not a problem. But most people have no effects at all, like no effects at all.
Is CBD good for pets?
And you can use CBD oil for pets too. If you have pets that have a little arthritis or just to modulate their immune system to make them have a little bit more efficient immune system, you can use this for pets too. That's a good idea.
Migraines and anxiety, can you use it for that?
Yeah, there are the CB receptors in your body. There are some in the brain that are stimulated by the CBD oil. It's not like tetrahydrocannabinol where you get the euphoria. They are stimulated more in a different fashion, but the result is that you do get some calming effects. Therefore, it can be used as an anxiolytic to decrease anxiety and decrease the stresses in your life a little bit. But it's nothing like the euphoria that you get from tetrahydrocannabinol. It's just a mild reduction in that. And it's not addicting. It's not addicting. And it's very safe.
We're going to post a special in the link on your page.
On our the TrueMD one, on our TrueMD site, on the Facebook site, we're going to post a little link to this webinar. So if you want to review it again, if you want to tell your friends about it, you can discuss it with them and they can log on and see this seminar again.
Good.
Any other ones? Well, I want to thank everybody for joining our seminar. I hope you have a wonderful night, and I hope I've helped you to understand a little and get a little bit more knowledge on CBD oil, and its difference between the marijuana, THC, and the benefits that you can get, the immunological benefits you can get from CBD oil. Thank you, everybody. And check out our website, too, at truemd.com. Well, good night, everyone.